The Real Reform for Early Childhood Development campaign has called for a national feeding scheme for children before they start formal schooling. The campaign argues that the national government is failing in its duty to address malnutrition among children. A recent South African Human Rights Commission report found that 116 children died of severe malnutrition between 2021 and 2022 in the Eastern Cape. For more on this conversation, we are joined by Anna-Marie Müller, who speaks for the Real Reform for Early Childhood Development campaign. Anna-Marie, good to have you on the program this evening. Firstly, can you provide insights into the current state of childhood malnutrition in South Africa, particularly for children under the age of 5?
Absolutely. Unfortunately, the last time a national survey was held was in 2016, so our data are a little bit out of date, but let's work with what we've got. So we know that at least 1 in 4 children under the age of 5 suffer from stunting, which is when a child doesn't reach their height potential as determined by their genetics. And this is the result of poor nutrition and regular infection during early childhood. We also know that very few children are exclusively breastfed for the first 6 months of life, much lower than the goals that we've committed to as a country. And furthermore, we know that children are not eating a minimally acceptable diet, which means that they're not eating a wide enough variety of foods at a high enough frequency. So children eat too little diversity to be able to consume the nutrients that they need to grow strong bodies and strong brains.
So as a participant in the Real Reform for Early Childhood Development campaign, I want to speak more about your role. What motivated your involvement, and what specific changes is the campaign advocating for here?
Absolutely. So we know that there's a wonderful national school nutrition program that feeds 9 million children in schools all over the country on a daily basis. However, there's a gap for children who aren't of school-going age yet. And although there is a ECD subsidy, only children who attend early learning programs that are registered receive that, and that only covers 15% of children from the poorest households. And this is simply too low. The most vulnerable children, when they are in ECD centers, should have the access to the ECD subsidy. It's currently 17 Rand per child per day, of which only 6.80 Rand is allocated to nutrition. And I'm sure South Africans will agree with me that 6.80 Rand for food is just not enough to grow a healthy child. There is, even with the child support grant, there's a 33% gap between the child support grant and the food poverty line. So we know that families need more support, and especially young children in this very critical part of their development need better support so that they're able to develop properly. And that's primarily what the campaign is about. We're calling government to account and making sure that they understand that this is, firstly, it's a constitutional right to nutrition, and secondly, the ECD sector is best placed to help them address this gap.
Anna-Marie, I want to zoom into your initial comments. I mean, in your view, how does malnutrition impact the overall development and well-being of children, especially those in the early stages in their education?
Yeah, so absolutely, this is a very critical thing to understand, that when the body is growing and very importantly when the brain is developing and there's a lack of nutrients, it means that the synapses, the connections between different parts of the brains and the brain matter itself doesn't develop properly. So if you consider that we struggle in South Africa with poor matriculation results, we're always talking about the matric pass rate, we're talking about a lot of youth unemployment. These are all consequences of not investing in the lives of children when they're very young. When we do make that investment early in the lives of children, we are better able to use the opportunities that come later. So children who are more nutritionally, have a better diet, are more likely to do well at school. They're more likely to earn more as adults. They're more likely to be more productive citizens. And they're also less likely to suffer from disease, which of course also costs our economy a lot. Our medical conditions like diabetes and heart disease do have a cost for the health sector. And so those costs must also be included when we consider the cost of not investing in young children's nutrition.
Could you elaborate a bit further on the limitations of the existing national school nutrition program and the early childhood development subsidy in addressing these nutritional needs of young children?
Yeah. So I don't want to comment on the National School Nutrition Program and whether or not it's meeting nutritional needs, but it at least feeds 9 million children every day, which I think is something to celebrate. But then when we look at the early childhood development sector, only 41% of centers are registered and only 33% actually receive the subsidy. So already we know that for the 60% of centers who aren't registered, there is no state support for nutrition. And when we look at those centers that are registered and we compare that to income groups, we know that only 15% of the poorest households are covered by that subsidy. So on the one hand, we need to make sure that registration of ECD centers is much easier, that we simplify that system, and that's also a campaign that the Real Reform for ECD is working on.
Sure.
But at the same time, we need to increase the coverage of the ECD subsidy so that more children have access to nutrition support. And what we know is that a child should not be penalized by attending an unregistered center, regardless of the type of center that they attend. They should have access to nutrition support.
So the Real Reform campaign also suggests a substantial increase in the subsidy per child per day. How do you believe this proposed increase could make a difference? And also, what challenges does it aim to overcome?
Sorry, I couldn't quite catch that. Are you asking about the challenges of increasing the subsidy?
Yes, the proposed subsidy, yes.
Yes. So we know that we're in a very tight fiscal situation, and there are many competing priorities that Treasury and departments are weighing up. And so our argument is that the cost of not increasing the subsidy or the cost of not reaching more children outweighs the immediate costs to the fiscus. But our research has found that we would need an additional 1.65 billion rand per year allocated to this subsidy or to nutrition support for children in ECD centers. And if you compare that to the 65 billion that's calculated as the cost of stunting, which is this condition when children don't get good enough nutrition, it's a very good cost-benefit analysis.
So the campaign also highlights that only registered early learning programs are also eligible for subsidies. How does this eligibility criteria then impact on the children who need the subsidy the most, especially considering that only 41% of ELPs are not registered?
Yeah. So the registration criteria are things like building plans, health and safety certificates, those kind of things that they all cost a lot of money. And most ECD centers in South Africa are run by women from a community who see the need to serve the young children in their community, and they simply don't have the availability of cash to pay for things like building plans that need an architect or a technical drawer to draw these documents up. And so those type of bureaucratic regulations do make it very difficult for these women who run small businesses to access the subsidy. And that is a real burden. And again, not something that the child should be, the child should benefit from state support, whether or not the center is registered or not. We're not saying that we don't need to look at the quality of ECD that is provided at the center, but at the very least, nutrition should be provided to all children attending early learning programs in South Africa, regardless of the status. If they are eligible for the subsidy based on the eligibility criteria, which is, are they eligible for the child support grant, they should also be receiving that. So we're not saying that every single child, but at least when there's eligibility for the subsidy, they should receive it regardless of the status of the center.
So given your involvement in this campaign, what do you see as the most critical recommendations that have been put forth by the Real Reform campaign? And how do you envision these recommendations being implemented on a national scale?
Sure. So we've engaged throughout the last year that we've been doing this research with the Department of Basic Education, which have the responsibility for coordinating ECD services in South Africa. And we've been very pleased with their cooperation and their interest in our work. We understand that taking on ECD, which formerly was the responsibility of the Department of Social Development, is a big change for the Department of Basic Education, and we're keen to remain an ally to them and share our research. They attended our launch event in Pinetown in Johannesburg, so we know that there is a partnership there. They are already implementing the National School Nutrition Program. They understand what it takes to deliver nutrition to millions of children on a daily basis. We're saying, let's help you understand the context of the ECD sector. And the important thing is we know what to do. We don't have to reinvent the wheel. We've got great national guidelines for ECD centers on what nutrition to provide. We've got menu cycles. We've got recipes. All of these tools are already available, but we need to capacitate the sector to implement that, and then we need to provide the funding to enable those menus to be bought at stores in the community and cooked for children and fed to children. So I think the important takeaway from the research that every child has a right to basic nutrition, and secondly, we have what it takes to implement this. We need the national ECD nutrition program, and we, as the ECD sector, we understand the importance of it, and we're ready to make our case to others to show the importance of nutrition in the early lives of children, and that ultimately it's to the benefit of the whole nation when we get this right.
Now, Anna-Marie, we have run out of time, but before I let you go, the National Treasury has also allocated funding for a pilot program. How optimistic are you that the research and recommendations from the Real Reform Campaign will be considered and also incorporated into this implementation plan?
So I'm quite confident that our research findings will be incorporated into that. In particular, we've made some recommendations about how to do the implementation. And we've recommended that we use a lot of the learnings that we have from the National School Nutrition Program, and that we use different partners like NGOs who provide services in communities already as partners. I'm pretty sure that the department will learn a lot during the pilot, and the communities ultimately where the pilot is, those children will benefit from nutrition, and that in and of itself is also a win for those kids who will get meals as part of the pilot, and then ultimately to scale it out across the country. We know we need to do this. We need to make sure that we are doing it right and that we have the money allocated on a yearly basis to ensure that nutrition is provided to all children who are eligible for the ECD subsidy.
Anna-Marie Müller, thank you very much for your time.